We did the treatments that I demonstrated at the end of the prior video. And now, when I palpate the inside of his sit bones, they are much more symmetrical. The movement, you notice I can load it down. That's called taking up the slack, and then I can spring it. Okay? Mm-hmm. And we can also load and spring the other side, and then we can load and spring in this direction to the left. We can load the left sit bone and spring it. And when I come on the back of the ischium, that's now symmetrical. This no longer appears posterior. I can now load it, and when I spring it, I see your feet move. Yeah. So the force translates through the pelvic joints, down into the hip joint, and down into the lower body. So I'm pleased with what we've achieved. Let's have you lie on your back. Okay. So I'm on the upper third, I'm on the middle third, I'm on the lower third. That's now symmetrical. Okay? Scoot down just a little bit. And we showed in that short video how the body compensates with the righting reflex. And your head was rotated to the right and side bent right. Mm-hmm. I can now spring it on the left side. Wow. So I can now rotate the head left very easily. Okay? And then when I come underneath the mastoid, I can lift up on the right side, side bend it left. Hmm. So this released reflexively by balancing the pelvis down below. Hmm. It might not be perfectly symmetrical, but per my eyes, the lower pelvis is now symmetrical. And the important thing is that it has motion restored. Okay, that function takes precedence over alignment. Mm-hmm. So let's have you walk down the hall and back.
Okay.
Just go to the end and back, yeah.
Okay.
Your thoughts?
Feels good. I feel like I don't know, it felt like when I walked earlier, I was kind of my weight wasn't really evenly distributed, but now it feels like I'm putting the same amount of weight on both sides of both of my feet, you know, a lot more than it did. It feels like to me.
Nice, yeah. Nice. When was the last time you felt that way?
I don't remember.
Well, more than 6 years ago,
yeah,
right?
Before I hurt my back.
Yeah.
Training. So
yeah. Maybe 7 years ago.
Yeah.
Okay. Come sit on the chair and tell me how you feel.
Okay. Feels good. It doesn't feel like my pants are like riding up into the right side of my groin anymore. At least right now, like it did on the plane on the whole way up here, and what I've experienced.
Can you demonstrate that?
Yeah.
Can you explain that a little bit better?
Yeah. So when I like the plane ride, and I'm a grad student, so I do a lot of work on the computer, and I constantly feel like I have to pull down this side of my leg, my pants or my shorts, and because feeling like it's like riding up. But right now I feel pretty good. I feel like both sides are how they should be. I don't feel like that constant need to pull down on that side. So I think something definitely has changed for the better here.
Good. You want the good news?
Yeah.
The good news is that this is usually a one-time treatment.
Okay.
The body likes correction. The body is made to function a certain way, and it likes to function that way. And when a large passive force causes it to get off balance, it takes an external passive force to bring it back in balance. So you can't do muscles to move the pelvis.
Okay.
Muscles don't create realignment, and Like muscle energy technique, it's very short term in improving alignment of the pelvis. But when you use passive prolonged forces, it's a lot more effective. So we did 5 minutes aligning your pube, getting the pubic bone to move. Then we did 4 different 2-minute stretches. And what's interesting is your coccyx straightened out.
Yeah.
I did not have to treat the coccyx directly. So it was being pulled by ligament and muscle forces with the lower pelvic malalignment.
Okay.
And again, to summarize, we don't know, how much of this happens inside the SI joint, because there's only a small movement in that joint. I submit that your SI joint and your pubic joint moves more than the average person of your size and weight, okay? But that you have hypermobility syndrome. So, maybe you have a little bit more movement in those joints than the average person. It certainly feels like that to me when I spring the pubic joint. On each side, it felt like more
Right.
glide than normal. But anyway, we can't measure that objectively in the clinic.
Right.
All right? Much of this could be the whole pelvis being twisted. The entire pelvis twisting on the hip joints, on the femoral head, the oval-shaped femoral head, and twisting with the lumbar spine and the abdominal wall. The pelvis attaches there as well.
Okay.
So I'm not hung up on a sacroiliac explanatory model.
Okay.
I realize the limits of the clinic, the limitations. No one has researched the intertestal reliability of these passive spring tests.
Okay.
No one has done that. The traditional palpation doesn't have very good intertestal reliability. It's about 60% or so. But anyway, this is an interesting case, and I'm grateful that you let me post it.
Oh, yeah. No
Thanks.
problem. Thank you.
And then lastly, if you had to do it over again, would you get your sacroiliac stabilized?
No, I would definitely not do that.